Left Wing Kingz. Listen, think, act, repeat.
As we age, planning for future care becomes increasingly important. But in the Black community, many of us disregard planning for our old age, which leaves us in dire straits when we reach our golden years. So we're going to enlighten our viewers with 5 ways to prepare for elderly care and their final preparations. So the first tip is assessing your needs. Evaluating your health care status and any chronic conditions you may have is important. Claude, what are some of the things we should consider as we assess our elder care needs?
The final expense insurance is very, very significant. In our community, we have challenges and issues with life insurance and whole insurance. There are companies out there that do provide final expense insurance. You can go to Omaha Health and call some other insurance agencies. Also, there are financial consultants out there that you could go and look at successful ways to ensure that there is funding and a guaranteed life insurance policy. Also, make sure there's a will in place. Make sure there's a trust in place. Make sure that there's a transfer of deed in place if that's something that you want to do, because we know how we are when people die. Everybody comes out of the woodwork through the windows to take the jewelry and trying to find out how much money is there. Mm-hmm. So take time to protect your immediate family, your spouse, and your children, and also to budgeting. Having some type of financial dream that turns into reality, that's remarkable for that success. Like, for example, I've mentioned to my spouse that, hey, look, the minute this occurs, I want to be put in a nursing home and for you to go on with your life. I don't know who you are. I don't know that you're even here. So financially, I'm making sure that I'm okay before it progresses and that there are things in place for my spouse and for other people to adhere to.
Right.
So that I could get the appropriate coverage that I need and that, things go smoothly. So again, you have long-term care, life insurance, whole insurance, guaranteed life insurance, final expense insurance. Now, if you go to an insurance agency and the final expense insurance, you cannot get it due to your medical condition, then I'm going to request for you to go to a local funeral home. And they also have final expense plans for you to start paying every 2 weeks, every month towards your final preparation, whether it be to have a funeral burial or to be cremated.
Oh, that's great info.
Yeah, that's real good info. We need a whole show on that.
Yes.
Okay. But definitely, Claude, no, good info. Black people, well, all people, no more barbecue plates, man. This is what they saying, man. When people die, man. Like,
no more suppers.
No more chicken quarter barbecue plates. So the chicken quarter ain't cooked good. Beans is cold, and all you did was take HEB potato salad and put a scoop on it and put it on the side. I'll just give you the $10.
Mix some pickle juice in it, yeah.
Yeah. So that's what Claude's saying right there, man. You got to make preparations, man. We can't be burying our people on chicken plate funds no more, man. So.
And you bring up a very, very good thing, because like I mentioned to you, I grew up in the hood, right, in New Orleans. And so we've always done suppers on a Friday and card games on a Friday to pay rent the following week, Mm-hmm. You could have those activities and have those parties, but if it rains and nobody comes, then you don't have the money to do what you want to do.
Exactly.
Yeah, we got to do a better job planning, and that's where the will comes into play and all of that. So
yeah,
we actually got to get out there and do a better job as a people.
Yeah, and you know, I don't know if all the kids know about this, but GoFundMe is probably something they know a lot better. They probably like, you know,
man.
you talk about raising GoFundMes.
Man,
you know,
look, I hate
GoFundMe pop
GoFundMe.
up all the time when somebody
Yes.
passes away.
Yes.
What we see all day. Now, I ain't shooting nobody. I ain't trying to say nothing bad about nobody, but this stops you from having to depend on the generosity of others. Just take care of it yourself.
Yeah.
That's
Handle
right.
it your damn
That's
self.
right. And you know, people are people, and you learn as you get older. You're in this battle by yourself. I know that I'm in this dementia battle by myself because I'm the one that's impacted.
Yep. Exactly.
Although there's people out there that love me and love me dearly,
Yeah.
it's all about me.
Yeah. And the last thing I did want to touch on for this, when we talk about the first tip, which was assessing your needs, is also as you're here and you, before anything even happens to you, make sure that with your primary care physician, you're looking at what your medication needs are, or like you did, you told your doctor, I want this drug. Have that conversation about, if you watch a TV, there's all these damn commercials about drugs that's going on
Absolutely.
every day with all kind of shit. You could be asking your doctor, hey, will this work for me? Will that work for me?
Absolutely.
And they'll tell you why it will or won't. And you could come to a decision with your physician, because sometimes you can start taking care of the symptoms and things ahead of your diagnosis, right? Before those things even come on. Make sure that you understand what your healthcare requirements will be when you go into dementia. Like you said, hey, I know what my requirement will be at this point in my life. I want to be in a home because A, B, and C, right? I know what my requirements will be. And understanding, if you are going to be in a home, what facilities are out there and what amenities do they have? What's their reviews saying? Things like that.
And shit, make sure you have family that's going to come and visit you because that's a problem.
Yeah, exactly. So assessing your needs it's a very wide-ranging topic, but I think that there are many things that people need to consider. And just like you said, I think it kind of ties into some of the things you said ties into our second tip, and that's creating a financial plan. So financial planning is a critical aspect of preparing for elder care. If you're living on a fixed income, your options for elder care could be limited. So how can we get fiscally fit, Claude, and preparing our wallet for some of those costs associated with elder care? And I think you brought up a few of them already.
Mm-hmm. Yeah, I brought up a few of them already. And you know, making a plan financially, as I look at this picture on the wall, you know, to be powerful and to empower ourselves and to be ambitious with finances is really a challenging thing. You know, because there are facts out there that there are many people that are suffering out there, you know, and I don't have it like that,
Right.
but I'm thankful to God for what I have because I know where I came from.
Yep.
And I remember where I came from. So just make sure that you have your living arrangements in place. Make sure that you decide as you age where you want to live. Make sure that your social and emotional well-being is in place. Make sure that if you have to have a financial person involved with your spouse or with your loved ones, that person has a dedicated point to those individuals so that they can work out a plan or determine and decide what needs to happen. Because God forbid, I don't want to sell my house to go to the nursing home. I want to be able to, leave my house for my loved ones and to go to the nursing home and get viable care.
Come up with some kind of structural plan and where you, and look at where you want to be at the end of your years, at your elderly years.
Yeah, and I mean, you just don't know in life what's going to happen.
No.
I have been a educated, self-sufficient, executive type leadership man throughout my entire life. Never would I have imagined that my mental would be taken away from me.
Right.
I had no concept of that.
Yeah.
I thought maybe I would, get to an accident and die, or maybe I would get a stroke or a heart attack or something, but not the mental.
Yeah.
Yes. So.
The funny thing is that we know this as individuals that we all think it's not going to happen to me.
Oh, absolutely.
And insurance is made for things that might happen. And a lot of us look at insurance like, man, I ain't worried about that. It might happen, it might not. But insurance is a cost until something happens to you.
That's
then
right.
It becomes a freaking benefit.
Oh yeah, exactly. and you know, we ignore the signs. You got to have insurance, a home choice program to come and fix your home appliances.
Yep.
You got to have insurance in case your house burned. You got to have AAA in case you have a tire. I mean, a car with a tire.
Yeah.
So we have many signs throughout our life to let us know that one day it's going to knock on our door because what they say, none of us are exempt from anything in life.
Exactly.
And let me add this point. I was going to add it earlier. Don't depend on your kids. They're going to take care of you. I mean, look at your kids right now. just think about it and look at your kids right now. Imagine them 20 years from now and you having to depend on them completely. It'd be like Trump in 2025, man. We in trouble, man. Like you be in trouble with that, man.
Well, you know, the shit part about it is that you don't have your kids, but you got Project 2025.
Yeah. You can count on that.
Yeah. So,
But when it comes to
the kids plan out the window.
Yep.
Yeah, and when it comes to like creating that financial plan, I do want to make sure that our viewers out there know too, there are government programs out there that you can look at and explore what's available out there. At least before 2025, we've got some programs right now. All right. So also, if you can afford to get yourself a financial planner, because they will put all types of shit. They know about all types of available options out there. Now, if you can't afford one, you know, there's still resources out there online that you can look up and Google for free, get some information on it. And a lot of us got family members who dabble in these spaces. If you got a second, third cousin that knows a financial planner or some shit, try to reach out to them and get whatever advice you can get for free if you can't afford it. But do something about it as early as you can. It reminds me of the earlier you do something, the better off you'll be. It reminds me of the story about, I don't remember this kid that started working when he was 16, and he put away some minimal amount of money every week.
Oh, yeah.
And he ended up a millionaire by the time he was 30.
That's right.
By putting a small amount of money away every week or every time he got paid or some shit, dude ended up a millionaire.
Was that at McDonald's? Was that McDonald's?
I can't remember.
That's called compound interest.
Yes.
Yeah, but I'm like, dude,
That's right.
There are simple things that you can do, like, but the earlier you start, the better. And I don't even care if you're 50, if you're 40, if you're 45. The earlier you start, the better off position you'll be in when you start putting that money away. So
That's right. Yes.
now, another thing that you could, you know, actually have, another thing that you can do that'll have a good impact on the world is clicking the like button. All right. So click that damn button. All right. And, you know, if you like this content, you want to share more of it out there, make sure that you click on the like button and also subscribe to Left Wing Kingz. And share our content on all of your social media platforms. All right. So tip number 3 was made famous by Kumo D. And Adrian, what did he say?
Go see the doctor.
That's right. Damn it. So historically, the black community has had issues with going to the doctor. We've not been proactive in managing our health or engaging in healthy activities. So, Claude, how can regular checkups with your primary care physician help you stay on top of your health and make informed decisions about the elder care?
So, you know, we kind of discussed this about 10 minutes ago, and we talked about early detection of health issues. That's one of the things that we tend to, especially from our culture, shy away from. You know, you have men that have chest pains and they're like, hey, you know, I'm going to burp this thing up and
take some Tums
and I'm not going to worry about it. And then, you know, your wife goes to sleep and come back down the following morning and find you dead on a couch. You know, early detection of health issues is very, 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 very important. You know, identify what those issues are again with your PCP. We've had this discussion. Monitoring existing health issues. You know, if you're on medication, for example, if you're on a diet management medication and you're having chest pains and the chest pains will not leave, you know, damn right that you're on a weight loss medication. Go to the damn urgent care. Go to the emergency room. You know, just knowing what those things are, having the appropriate screenings. You know, us men, we dare colonoscopies,
I knew you was gonna say it.
mammograms. You know, people don't go. You know,
Hey,
and,
man, my doctor won't answer the phone. I keep calling.
Use a lot.
yeah, you keep calling. Yes, light your pants on fire.
Yeah, I call.
Light
Like they don't
your
want that
pants on
money.
fire. Yeah, absolutely, absolutely,
he ain't
absolutely,
answering the damn phone.
absolutely. You know,
Seriously.
and I just basically call it the black coat, because you have so many men that don't go and get colonoscopies, and it is imperative if you want to live with your family and do the right thing for your family. Go and get those things done.
Yeah.
You don't know how many people that I talk to, especially males, that look at me and say, "Oh man, look, I'm going to shoot basketball. I don't give a hell about no damn colonoscopy." All right. I had a scare about 5 years ago where I had a precancerous polyp that was 8 millimeters, I think it was, that they took out of me. And the doctor told me, "Well, we'll see you in 7 years." I don't flip and think so.
You gonna see me next year.
You just took an 8 millimeter
Yeah.
precancerous polyp out of me,
Nah.
and you gonna tell me I'm gonna see you 7 years from
No,
now?
you're not.
What black fool are you talking to?
Exactly.
It's not gonna happen. And so those are the things that you have to take advantage of and have a building relationship with your PCP. My PCP and I have arguments and have problems every time I go. And I have threatened through patient advocacy to get a new PCP. Know who you are holistically as a person.
Yeah.
And an attorney, Trump, Project 2025, anything does not move you at all. Stand up for who you are and be confident in who you are.
Yeah. Now I'm lucky. I have a great relationship with my PCP. So if she watching, you know, treat me right. But at the end of the day, me and my PCP, like you talked about colonoscopy. She said, "Hey, you know, get one as early as possible." She was like, "Get one at 40." I was like, "All right." I've had 3 since I've had one every 5 years.
Yes.
30,
Good for you.
40, 45, and 50.
Good for you.
Had my colonoscopy. You know, nothing, you know, knock on wood. They found some polyps the first time.
Sure.
You know, none of them were malignant or anything like that. You know, all
Good.
benign. Everything was good. But
Good.
the point is, I know
Oh, absolutely.
right now my
Oh, yeah.
my situation.
Yes.
And I don't have to worry about it because guess what? They told me now, well, they said me, well, you can come back in 5 more years or whatever. I'm like, all right, cool. But at the end of the day, if something happens, you know, I'll blame their asses because I've been there all the time. So I'll blame all these motherfuckers for doing my shit wrong.
Oh yeah, absolutely. Yeah, absolutely. And you know, one more thing. I had a doctor that gave me dementia medication when they first diagnosed it, and I had uncontrollable poop and urination where I had to wear diapers.
Oh, man.
Okay, so imagine in Navy.
write this doctor's name
So
down.
imagine. That's a damn good one. So imagine being in Navy Federal with white shorts on.
Oh, no. Hell to the no.
You know, and so
I
you
can't
know,
roll like that player.
you can't roll like that player. Yeah, I hear you, homie.
But one other thing I did want to touch on before we go on to the next topic was you brought up like you know, not knowing like things just coming on. I think you brought up, and I've had my brother. Like you said, you have a damn, you know, you think it's heartburn or some shit, but the next thing you know, you're having a heart attack. That happened to my brother. Like he was like having mini strokes. Had no idea. This was happening for months. He didn't do shit. Just, oh, well, I don't know what that was. I just kind of froze and I just this. Or, you know, he was having strokes. And then finally he had like a bigger stroke where that shit sent him to the hospital. And then he found out, well, sir, this whole time you done had like 60, I don't know how many strokes, a bunch of strokes, a bunch of mini strokes because he ignored it. He acted like it was nothing, didn't go. I had a friend of mine who had a heart attack. Okay. And he told me, like, first of all, he had a heart attack. And instead of calling 911, and this is another thing black folks do because they don't want to call, they don't want to pay the expense.
They don't want that $1,000 ambulance bill.
Exactly. And his insurance or whatever the case may be, I don't know what it is, but he drove himself to the emergency room and collapsed in the parking lot. He could have collapsed while he was driving.
Yeah.
And imagine what the story would be today about him
Or he
or
could've got
about
treatment.
someone else.
Yes.
Yeah.
You know what I'm saying? Instead of going in the ambulance. So we make a lot of decisions, unfortunately, based on cost versus care. You got to care about yourself first.
Yeah.
They'll look.
You got to be here to spend the money.
I'll let that shit go to my credit report, nigga, before I die.
Yeah.
Okay? I'm going to go to the hospital
And get
first.
in line. You
You
know,
know
go
what
and
I'm
get in line with
saying?
everybody else. You know what I'm saying? I ain't going to die on it, dog. Like,
Yeah, I'm not going to die on this shit.
And by the way, President Biden is working on an initiative that will not allow you to have your medical discrepancies on your credit report.
That's good.
Look into it.
Yeah, I heard
That's
that.
good.
I heard
Yeah,
that.
look into it.
Because we got a lot of those.
Yeah.
Not me personally, but black folks. So, speaking about these tips here, I want to go into our next tip, which is kind of like what we just talked about, like cost involved, but there's a cost that comes with purchasing insurance. And that's tip number 4, to get some insurance. You touched on it already, Claude, so we don't have to go in depth on this one. But, you know, a lot of people out there don't think about insurance until it's too late.
Yeah.
And having insurance in place, you know, can take care of your needs while you're here. And like you said, life insurance while you're gone. There's a lot of good different types of life insurance. But to my point earlier, the earlier you get it, the easier it is to get, right? And before you have healthcare issues, the easier they are to get. So these are things that, you know, we want to make sure that we're looking into now and not waiting until later. But that's tip number 5. Really, I'm just going to kind of talk to it. We're not going to go into the question because we're running short on time on this one. But get yourself some long-term care insurance, life insurance. Those things are important. And then tip number 5, I'm just going to jump into tip number 5, you guys. So tip number 5 is creating a support network and creating your final preparations. And we also kind of touched on this one. But building a strong support network, that's something that you got to do to be able to discuss your current needs, your future needs, and your final preparations. So this could include, like you said, Claude, your family members, friends, your healthcare professionals, all types of people. Claude, what are some of the things that you should discuss with your support network to make sure that you're ready?
Well, you know, one of the most damaging things within our community is to die and our people that we leave behind hustle and bustle and fight over $5,000, fight over diamonds or jewelry, you know, have access to your house and go in and look at what you have in your house. The only thing that's viable for that is to make sure you have your ducks in a row. If you're not educated, talk to someone in your family that is educated. Talk to friends that are educated. You know, go out to some of the support groups out there and find out what is needed. Look it up on Google. There's a lot of information out there on Google. You know, people like us that are middle class people, you know, we have financial planners and financial consultants that we can go to, and we are privy to have that resource right in front of us. You know, even with stocks, you know, I'm privy to have what cheap stocks to buy today that will benefit me 10 years from now or benefit me 5 years from now.
Right.
You know, it's sad to say that not everybody is there.
Yeah.
And so, you know, reach out to people. If you don't know how to write a will, go on Google. There are will templates out there. One of the most damaging things that you could do to your family and to your loved ones is to not have a will and go into probate.
Yes.
A year or 2 years after that. I have seen so many siblings that mom and pop thought that they were a confined family. And the mom died and the dad died.
People come out the woodwork.
And the siblings are fighting like rats looking for cheese. What a damnation to our society. What a damnation to our culture.
Yeah.
What a damnation to your family. You know, I was talking to a friend just yesterday, and I'm like, you know what? Your mom and dad are turning in their grief with the bullshit that you all have as sisters and brothers. And I told my best friend, I said, you know what? I don't want to get into your family business, but get every damn body on a conference call. Let me talk to them.
Sound like you got in their family business.
I know.
You didn't want to though. But
That was a damn disclaimer.
but sound like
And
you
you caught it.
Yeah.
But you know, it's just one of those things. Get your shit in order before you die so that your family can live and your friends can live based on memories and not damnation.
Yep.
Yeah, we all got them stories, man, of people when somebody died, you know, it's just people coming out to fight over them crumbs, you know what I'm saying? We all got them stories, yeah, so sad. So, yeah, take care of your business, man. Write a will, you know, and like I said, don't depend on what, man, once I'm gone, or even worse, man, I'm gone, man, it's whatever. I ain't here no more. That's even worse to say, you know what I'm saying? Don't put your family out there like that.
And you know, I found out for me, and one more thing, I found out for me that a friend of mine told me that when her mom passed, her mom wrote letters to all the siblings, all the grandchildren, all of the family members. And that's something that I'm doing. I'm writing letters to all of my family members. And I'm going to assign one person to make sure that they get those letters, whether it's good or whether it's bad. Because I think people need to know how you died.
Yeah. You know, it's also important to, you know, like you said, have something in writing, man. When you talk about like a will, that's critical. Like that's the best thing that you can have, man, because people talk. Well, grandma said I could have this and that.
Yeah.
Nah,
The car was mine.
nah. Yeah, the car is mine. Nah, y'all can argue. You can even maybe grandma did tell that person that, but it don't matter.
It's
right?
just it's just like
not
in
legally
health.
binding.
I got the keys, though. I got the keys.
Yeah.
It doesn't matter.
Don't matter.
Doesn't matter. I
None
can
of
get
that
the car.
Yeah.
The
Yeah.
police can get the car. It doesn't matter. It's just like if you don't document you had the flu vaccination, it's
Yep.
null and void.
Exactly.
You didn't have it.
You didn't have that COVID. You didn't get that COVID vaccine.
Yeah, I get it.
It's null and void. So when you go into that club and they're asking you for your COVID ID and you're missing that last shot, get the hell out of here.
Yep. Exactly.
You know, people
Exactly.
still walking around 2024 worried about COVID. Like, go get the shot,
Yep.
bro. I be telling people, you still worried about COVID? That's an old disease. They got new diseases out. They got a new one of them.
They
out
got
there.
the bird virus now.
Yeah.
Okay.
Yeah.
But
You still on COVID?
It's the bird virus now. But see, people are still leading on to that conspiracy.
Yeah.
And the conspiracy, I'm going to say it, is for the non-privileged, poor individuals that are not educated and know that we're not giving syphilis in this day and time.
Yeah.
Yeah.
Bottom line.
They put them, that's who dies from this disease. You know, they put them at risk. You know what I'm saying? So,
Exactly. You
like,
know?
go get your COVID shot, man.
Exactly.
We had that conversation no more, man. Been out 4 years. Ain't nobody dying from the shot. You know what I'm saying? You know, come on, man.